So welcome to everybody. I'm so glad to see everybody joining us today for this great subject. Before we get started, I'd like to remind people about a few general rules about how to engage with the content. We're asking that during our time together, everybody keeps their microphones muted unless they want to speak. We are asking that you use chat to make comments or ask questions, at least until the end, when we're going to open it up for a question and answer session. And that will be after we go through the slides, and there'll be about 10 or 15 minutes when we can ask questions of the presenters. We ask, when you do ask your questions, not to disclose personal details about your child or your case. Try and keep your questions general. And if you have any problem accessing the captioning, we were experimenting with it before you came on. It should work at the bottom. You can message in chat if you're having trouble with that, but it should, ideally, you can select closed captioning. So as many of you know, PEAL is Pennsylvania's Parent Training and Information Center, and we serve families across the state of Pennsylvania. We do this, we empower families of children and youth with disabilities to access information that they need to advocate for their child and for themselves, to be fully included at school and in the community, and to be able to access physical and mental health services whenever they need. So we do all of these things and more, and we ask that you spread the word about PEAL and about our available services to families across the state. Please also visit our website when you get a chance, and we'll have that information available to you at the end. So today we are going to hear a wonderful presentation. We're thrilled to have our presenters here today on the topic of neuropsychological evaluations, informations for families. So specifically for families to use as they look into the possibility of accessing and using neuropsychological evaluations. And I am going to, I'm thrilled to pass it over to Sarah Laughlin, who's going to introduce herself, and the other three members of the team are going to also introduce themselves as they get started. So let me stop sharing my screen. And then
I'll share.
Sarah will, yes.
Says I cannot share my screen yet. Was I? Oh, there we go. Gotcha. Okay.
Perfect.
So here we go. Okay. Hi, everyone. It's good to be with you in this virtual space today. Thank you to PEAL and to Sue and to Mayor Hartley and everyone who is within the PEAL Center, who's been incredibly collaborative and welcoming. I have worked in relation to the PEAL Center through the LEND program at the University of Pittsburgh, and which is also associated with UPMC Children's Hospital for a few years now, but really dove into that relationship with a little bit more intention this past summer to come and visit and to get to know everyone working in the center and the mission and the day-to-day workings and how we may be more collaborative in a local setting, but also educationally. So this idea of today came out of those discussions since the summer, and I'm thankful to be collaborating in providing some family-centered information with my colleagues through the LEND program, Dr. Rachel Robertson and Kateri Beecham, who is the family resource specialist. So I am a clinical neuropsychologist and clinical psychologist by training. I have I hold an assistant professorship at the University of Pittsburgh in the School of Medicine in the Department of Physical Medicine and Rehabilitation. So I see children and families in that context. Clinically, children who have complex medical needs that impact their brain function, like for instance, traumatic brain injury, seizures, and epilepsy, or neurogenetic conditions. So I often see families in the context of a medical setting, but what we do as neuropsychologists is looking at their broader skills, which we'll talk about in a little bit. So I just wanted to say thanks for having me. Thanks for sharing this time with us today. And I'm going to pass the introductions along to Dr. Robertson.
Hi, everybody. I'm also very thrilled to be here today. My name is Rachel Robertson, and I'm an associate professor of special education at Pitt in the School of Education. And I'm also a board certified behavior analyst and a certified special education teacher, pre-K to 12. And most of my background, as well as my research, has really focused on students and adults with autism who engage in challenging behavior, and their families and their teachers, and really supporting everyone in developing positive behavior supports for those individuals. And I'll pass it over to Kateri.
Good afternoon. My name is Kateri Beecham, and I'm one of the family resource specialists here at the Pill Center. I've been on this advocacy journey for over 10 years now, and I'm here today to sort of give you guys the perspective of being a parent. And how do you utilize neuropsychological evaluations, and any questions that you have from the parent perspective or the family perspective. That's what my role is here today. Thank you.
Thanks so much, you guys. So this team is going to talk through a few different ideas, and I'm going to move on to our first slide to share a little bit more about what is a neuropsychological evaluation. And so as a neuropsychologist, my perspective is kind of very much related to kind of what this discipline defines this as. And so a neuropsychological evaluation is completed by a neuropsychologist or a clinical neuropsychologist who's really thinking about the link between someone's brain function and their behavior, or kind of what you can observe in their behavior and their thinking, social emotional function. And so we think about an examination that looks at that outward expression of thinking skills. Like an example would be someone's attention capacity, someone's ability to problem solve with novel things that they've never seen before, to process visual information and perceive information using their visual system, or for instance, using their language and verbal skills to either express themselves, to understand something that's verbal, or using language and to problem solve using their language. So those are some examples of thinking skills. We also, in that kind of an evaluation, look at behavioral function broadly. So those things might include, under the umbrella of behavior, what we would call externalizing behavior features. So that includes hyperactivity, so a lot of activity, a child feeling like they're running on a motor, evaluating behaviors that might get in their way of functioning adaptively, so aggression, self-injurious behaviors, but also just behaviors related to how they engage with others in their environment. And the ratings of those things are often gathered through reports of informants, so a parent, for instance, or a teacher or a therapist who works with that child more regularly or sees that child in their day-to-day life outside of the evaluation period. And then in terms of social emotional functioning, we're often looking at more internalizing behaviors or ideas or traits or symptoms. And so that would be things like how is a child feeling about themselves? What's their self-esteem or their self-worth component? What are, if any, symptoms of anxiety or sadness or worthlessness, depression kinds of symptoms? We would look at how they're doing with peer interaction, how they feel about their peer interactions, how they feel about their interactions with their teachers, how they feel about interactions within their family or their relationships within their social world. And so it's comprehensive in the ways it looks at kind of someone's psychological health or psychological function. So a neuropsychologist is a specialized, excuse me, type of clinical psychologist. Clinical psychologists really focus on human behavior. It's defined broadly here in neuropsychology as looking at thinking skills, behavior, and social function. So how do we examine these things then during an evaluation period, which can last anywhere from half an hour to some neuropsychologists might, extend things over 2 days and do many more hours of assessment in their evaluation, depending on the goal, the neuropsychologists themselves, the age of the child often dictates how long you would spend with them, and their stamina for sitting with you and doing that kind of an assessment. So we often use standardized, or we do use standardized tests and procedures. And what the word standardized means is, excuse me, that it's a evaluation tool that's been developed to measure, with the intention of measuring certain kinds of thinking, behavior, social emotional skills. And so it was developed with that intention. It has been tested on different norm groups to assess whether it actually does test the things or assess the functions that we think that it does. And then a lot of different people of different ages take that test and create what we call a norm group. So it defines kind of what is average on that kind of skill within the population for a certain culture and gender, for instance, and then it allows us to then assess individual children and compare them to this large group that's this kind of normative or standard sample, and assess whether a particular child is kind of similar to their peers, or has more needs than their peers do in that area, or is doing exceptionally better, excuse me, exceptionally better than their peers in a certain domain of function. And so those are the different kinds of assessment tools that we might use. If we're looking at thinking skills, often it's assessment that's where a child is sitting at a table, or if it's a very young child, maybe sitting on the floor or in their parent's lap, and they're completing some different pushes in terms of presented with different kinds of materials like blocks or verbal questions, where they're then kind of expected, or we anticipate a response of some kind, and we evaluate their responses compared to kind of what would be the standard or accepted kind of response for someone their age. So an example would be, for instance, giving a child blocks and asking them to look at a picture and make their blocks kind of fit to a shape that looks similar to what they're seeing in a picture form, to assess, excuse me, their visual perceptual processing of information and their problem solving skills. So that would be one thinking skill area and kind of test that you might give to look at that thinking skill area. In terms of behavior and social emotional functioning, often in a neuropsychological evaluation, those areas of someone's overall self are evaluated through parent report, teacher report, other people sharing their view of that person, to try to give a more well-rounded picture of how that person is doing, or that child is doing behaviorally, socially, and emotionally in the areas and places where they live, work, and play for most of their time of their day. So the neuropsychologist will have some of that information from history, from the teacher, the parent, and other individuals in that child's life that then speak to those different areas of function. And on standardized questionnaires that a family or a school system, for instance, might fill out, it does ask very kind of specific questions that get at different kinds of behavior and different kinds of social emotional functioning. And it helps us compare that parent's rating for that child of age 7, for instance, as a kind of example, and how does that parent's ratings of that 7-year-old compare to most other parents' ratings of 7-year-olds? Are they rating them as having more hyperactive behavior, for instance, or less than a child who's 7, and where most parents are rating them in terms of a comparison to their kind of age mates on those different behaviors? And so those are the ways in which we get a more well-rounded assessment of someone's behavior and social emotional skills through a neuropsychological evaluation. So the evaluation itself includes excuse me, direct work with a child or an adolescent. So my focus today is really on neuropsychological evaluations that are child or pediatric. Pediatric tends to mean an evaluation that takes place for a medical reason or in a medical health setting, but a more child and pediatric focus, meaning not adult related neuropsychological evaluation. These evaluations include direct work then with the child and the adolescent. So the provider, examiner, or neuropsychologist is seeing the adolescent or child in an office setting, for instance, and doing direct kind of face-to-face work with them around certain kinds of tasks to assess their thinking skills. We also gather, like I said, reports from parents and teachers, therapists, other doctors. So we would ask for questionnaires to be sent back to us from teachers or parents. We would ask for therapists to comment. We would be reading available external documentation about how the child's doing in different therapies they might be in, for instance, occupational therapy or speech therapy, notes that are kind of describing what the child is doing at that time, and then other doctors. So physicians that the child works with, or other doctors in their life if they have a clinical psychologist working with them in a therapeutic setting, for instance. We might ask for a release to talk with them to hear more about how they're doing, to get a better sense of their whole social emotional functioning, not just what we see of them that day. And as I mentioned, we review records. So often a family will be asked to bring a lot of educational documents so that they've had an evaluation through school, for us to be able to see what that looked like and to get a sense of their past evaluation time points and how their developmental kind of progression has been through their thinking skills and their social emotional growth over time. Children are kind of moving targets in that way. So we just want to have a sense of what the past has been like so that that informs your kind of present idea of how they're doing and in relation to themselves, kind of how they're doing at that moment. So these evaluations are completed by licensed clinical psychologists with specialized training and expertise in clinical psychology, number one. So you do have to have a license. It's a licensed doctoral degree, and the doctoral degree is either a PhD or what's called a PsyD. So there are two kind of educational avenues to getting that doctoral degree in clinical psychology. And often what that means is an undergraduate education plus a doctoral level education. So it's usually 4 to 7 years of a doctoral degree. And then you would have an extra year to 2 of postdoctoral training and licensure to be a clinical psychologist. So that's kind of the progression of education and training. If you are a neuropsychologist, so anyone doing a neuropsychological evaluation would then also have some added training to that clinical psychology base. You do an extra 2-year postdoc specifically in clinical neuropsychology. And what you're focused on in that 2 years is also kind of more about neuroanatomy, meaning kind of how the brain works and the different parts of the brain function, and how that relates to human behavior, thinking, social, emotional functioning, so that you can think about people's complex brain differences that you might be seeing and how that relates specifically to what we might expect or predict in terms of changes in their thinking. So we're going to talk next a little bit about differences between a school evaluation and a neuropsychological evaluation. And my partner or colleague, Dr. Robertson, is going to talk a little bit first about school evaluation specifically.
Sure. And I probably should have said when I introduced myself that I come to this topic with a background in special education, and really would not describe myself as knowledgeable about neuropsychological evaluations, which we'll be talking about later, the disconnect between the neuropsych eval and the school side. But I am an illustration of that. So I thought that I would talk a little bit more about the school evaluation. We'll talk a little bit about some of those differences. But the school evaluation process is one that can be complex and look very different depending on the type of school or district or program that your child is in, and also where their current placement is and what their needs are. So there really isn't kind of a one size fits all, but typically what would happen is that it would be initiated based on some kind of challenge, pattern of challenges that the individual has shown at school, which might be academic or behavioral or a combination of those. And first, Sometimes people talk about like a multi-tiered kind of approach to an evaluation. And the first tier is sort of looking at the bigger picture of the classroom or even the whole school and making sure that any challenges that an individual is facing are not the product of poor teaching strategies or, just lack of clarity in terms of procedures or expected behaviors or reinforcement or something like that. So just checking to see that this isn't an issue that many students are having, and that maybe there are some specific needs that this individual is having that we need to dig further into. And as that process goes on, and perhaps there is evidence that this is an individual need that your child has, then eventually that may trigger, a school evaluation that's really an educational evaluation that involves a school psychologist and many other disciplines, depending on what the needs are or the goal of that evaluation process is, right? So there may be speech evaluation involved with a speech therapist or occupational therapy or physical therapy. So it's really a multidisciplinary evaluation process that's used to better understand the specific needs that this individual student has in the school setting and better understand why they're demonstrating these challenges with their academic and or behavioral functioning in school. And on the note of the behavioral functioning, one thing to keep in mind is that if you are a parent of a child who is undergoing an individualized school evaluation, you can request for them to do an FBA, which stands for a functional behavior assessment. And this is particularly something you would want to know and request if behavior is a piece of that challenge that they're experiencing. And by behavior, I mean whether it's getting out of seat often or, disruptive behaviors that are considered disruptive to the classroom or the teacher, or more significant, quote unquote, severe challenging behaviors such as aggression or self-injury. It would be really important to include an FBA as part of that process, which really goes into understanding, what purpose is this behavior serving for this child in this school setting or in this classroom setting, which can be very interconnected with the academic challenges that they may be having as well. So at the end of that process, you would have, a write-up of what the findings of that multidisciplinary school-based evaluation, what those findings were. I'll pass it back to you, Sarah.
Thanks, Rachel. So the, oops, let me get back to my slide. There we go. Okay. So if you think about this, and so the kind of comparison of these two ideas, so you have a school-based evaluation. They're both different ways of gaining more information about your child, right? And about their specific needs. But there are some clear differences about the goal of each of them, and about the kinds of people who will be involved in the evaluation itself. So, and the settings where they happen are different. So a neuropsychological evaluation, in terms of settings, you might see happen in a hospital setting where children are being seen because of their complex medical or psychiatric, meaning mental health kinds of difficulties. But in a hospital setting, if a neuropsychologist is seeing someone, often it's because they have an underlying known brain related diagnosis, medical diagnosis. And so it's related to that their providers, meaning in the hospital system and elsewhere, may want more information about how that brain-related difference is impacting their thinking, social emotional functioning, et cetera. And so that's one setting where you might see a neuropsychological evaluation happen for very specific reasons related to the brain functioning of that child that are assumed to be maybe affected by their medical background. Another setting where a neuropsychological evaluation might happen is in a private practice setting, or a community provider who's a clinical neuropsychologist working from their own practice setting. And so they might see children who have varying kinds of needs. So not just more kind of medically, physiologically driven reasons for differences in their thinking skills and behavior, but also more broadly, the impact of psychiatric conditions, the impact of environmental effects, for instance, child maltreatment like abuse or neglect impacting someone's thinking, and also more broad social, emotional, mental health function. I have worked in child psychiatric kind of centers where the focus was a lot more about mental health backgrounds and environmental impacts versus medical impacts on someone's psychological health and thinking. So it really depends on the setting where a child is being seen by a neuropsychologist that can augment or kind of shift the way that the evaluation is focused. And so as a parent or a family member, you can think about how that then impacts the product you might get at the end of the evaluation. But in all of those settings, no matter what the setting of the neuropsychological evaluation, the provider will be examining thinking skills. So I gave examples of that already: attention, concentration, visual information processing, verbal or language information processing, something called executive functioning, which is your ability to be planful and organized towards a goal. So you're flexible thinking, you're being able to inhibit yourself and stop and think before you do something. Your intellectual functioning and your academic achievement could all be assessed in a neuropsychological evaluation. And those are not necessarily always assessed by a school psychologist who would be working in a school. And so the focus of the breadth of the evaluation is broader than the schools in the different kinds and domains of psychological functioning we might look at than what the school does, but the intention is different, which is why it's broader. So the school's evaluation focuses more generally on different kinds of psychological functioning that impact education in the school environment. So we help focus.
I'm sorry, just because it's right around what you're talking about, we do have a question related to this.
Sure.
The question is, so can a school do a neuropsychological eval? She says, I feel like my daughter's triennial evaluation was a full neuropsych evaluation. School psychologists conducted it, but it included all the things you described.
So the short answer is, unless a neuropsychologist, meaning someone who's completed all of those pieces of training, completed that evaluation, it wouldn't be considered a neuropsychological evaluation. That's the short answer to that question. School psychologists, depending on their own training background, and there is variation in training backgrounds of neuropsychologists as well as school psychologists, may have slightly different ways of approaching an evaluation based on their own unique expertise and backgrounds. And yes, to your point, I have in my review of educational evaluations and reports also seen, very different skills assessed depending on the school system that's doing it and the specific school psychologist. So you're correct, there's a lot of variability, and some school psychologists might do a bit more and kind of move into some of the domains of psychological health and function I'm talking about in their assessment. But I think it's not necessarily something that you should assume will happen in a school setting. In the same way you should assume that it will happen in a neuropsychological assessment that's kind of bound by that breadth of domains of function. Does that help?
It sounds like there are a number of different ways that people understand that word neuropsych evaluations, and perhaps they're used more broadly than you're suggesting. So
I think the term can be used inappropriately sometimes, meaning kind of off the target definition that the professional boards that are kind of the governing bodies of neuropsychology as a field would deem appropriate. So meaning people kind of using that term to define what they're doing, but not actually engaging in neuropsychological care with the training background that is required to call yourself a neuropsychologist or to be engaging in a neuropsychological evaluation. So yes, I think it sometimes is kind of a term that you see in different places where maybe what's the activities and the training background don't support use of that term connecting to it.
One more small clarification, and then we can go ahead and move on.
Sure.
So people often think about finding out if their children have learning differences, for instance, dyslexia, and so forth. Often these are spoken about in terms of the neuropsych eval. Can you speak to that a little more?
So and Rachel can speak to this as well, but so a school evaluation is definitely able to determine, and part of one of the big pieces of a school evaluation may be often to assess for a specific learning disability. And so what you're describing as dyslexia is a type of specific learning disability or disorder. And so it's under the umbrella of that bigger term of specific learning disability, the term dyslexia. And so school-based evaluations often do that kind of an assessment to determine if a child kind of is eligible for support in a school based on having a specific learning disability. Rachel, did you want to comment about the school side of that?
No, just I mean, from my perspective, so the most intensely I've been involved in school evaluations is more on the FBA side, but from my experience, schools can definitely identify specific learning disabilities. But I don't know exactly how the school psychologist or other folks would go about determining that, like you said, under the umbrella of a specific learning disability, specifically this child has dyslexia. I'm not exactly sure how they tease that out.
So I can speak to that part a little bit. So, a school evaluation generally is able to and should do all of the pieces of objective assessment, meaning of someone's maybe intellectual functioning, their academic achievement on standardized testing, and looking at their history of achievement in school. So history is part of that conceptualization or diagnosis. Is have they struggled in certain areas, kind of historically speaking, and over time, have they responded to intervention and still, despite intervention, maybe struggle, right, in that learning area. And so those are all kind of fundamental pieces that you have to show kind of evidence of difficulty to have a specific learning disability or to go under that umbrella. A neuropsychological evaluation can also do all of that kind of an assessment, and a neuropsychologist who works with children and who's trained in child neuropsychology can make those decisions. But we work from different diagnostic or kind of eligibility frames. So a neuropsychologist works from what's called the Diagnostic and Statistical Manual of Mental Disorders in terms of how we define what is considered a mental health diagnosis. And so because we're in that kind of discipline, using that frame, when we think about kind of categorization of challenges, it's a little different than what the school uses. The school system uses education law and IDEA, which is a public kind of policy to indicate eligibility for certain kinds of disability categories that would then allow or kind of allow the entry of special education support based on that eligibility. So it's a different way of thinking about similar things, and the process then becomes different because the way in which we think about it and the systems of care are kind of different. But we're really talking about similar things. I think sometimes the terminology and the slight differences in our terminology get people kind of confused that what are the similarities and what are the differences. So dyslexia is a type of specific learning disorder or disability. And we would, as psychologists, call that a specific learning disorder with impairment in reading. And it's just a specific kind with very specific kinds of difficulties reading that kind of go under the umbrella of dyslexia. But it's a comment that comes up a lot. And I think, so I just consulted with a school psychologist in the Pittsburgh area school district in preparation for this today. And she talked a lot about how one of the biggest things is having an outside evaluation that talks about dyslexia and using that term very specifically. But the translation of terms from, we're kind of talking about the same thing sometimes, but the term gets people kind of stuck a little bit. Are we talking about the same thing? And is my child going to get the right services that are specific enough for this? And so I think that's a really good question that came up. So this kind of talks a lot more in detail about how these two kinds of evaluations may work together or not, kind of work together or create confusion. And so hopefully this discussion today helps clarify a little bit about how we do work together and collaborate, but how we may be using slightly different terms sometimes, and that's a bit confusing, right? About, are you on the same page across these different planes where you're having information come through by your child. So to finish up about the neuropsychological evaluation piece, what we're trying to do is promote understanding of what you may predict as future difficulty as well, based on what we're finding for a child's current profile of thinking skills. And so we know, based on a lot of research that's been done over time, that certain kinds of thinking challenges early on in a child's development may predict later kinds of challenges in function. And so we also speak to kind of predictions about what may occur. So a neuropsychologist is especially trained to think about kind of brain differences, how that relates to someone's function, and what that may predict for someone over time in terms of their needs. And so we talk more about kind of future planning in that way as well. And we may make diagnoses from the Diagnostic and Statistical Manual of Mental Disorders, which I referenced just now about social emotional or behavioral disorders that impact the child's function in a negative way. So for instance, anxiety disorders, depression, we might make diagnoses related to neurodevelopmental disorders like autism, or we might make diagnoses related to externalizing behavior like oppositional defiant disorder or conduct disorder, those kinds of diagnoses, or even post-traumatic stress disorder. So it's a kind of broad look at someone's psychological function, thinking skills, etc. But we do not provide multidisciplinary evaluation. So we are just a psychologist or neuropsychologist. We are not also having an OT or a speech therapist or a specialist in behavior analysis come in and also do parts of the evaluation. So it is more limited in terms of the disciplines that you think about being involved than a school evaluation would be. Okay. So when and why would a child get this kind of evaluation? The most common reason that I will say anecdotally, but also talking to school psychologists about what they see for outside evaluations coming back to schools where they're given an evaluation to kind of consider in education planning, for instance. So the most common reason that we see at the Children's Hospital for someone wanting or child getting a neuropsychological evaluation would be that a parent is looking for one. And then also that their physician or specialist who's working with them because of the medical condition that is thought to impact their brain and thinking skills and more broad functioning. Because of all of that, the physician then refers them for this evaluation in the hospital setting. So that's one way a child might, or when a child might get one in a more health system context. In a community setting, there might be other reasons. So I think in a community setting, they're much more family and parent driven requests than in a hospital setting where the physicians are much and kind of providers health-wise are much more involved in that referral for the evaluation. So in a community setting, parents may reach out to agencies or private practices that provide these kinds of assessments or evaluations. And then it's a parent initiated or family initiated request for evaluation. It's much less common, and there are fewer neuropsychologists who do the kind of work where a school is initiating the evaluation. And actually, the criteria in our local area suggests that school systems themselves have lists of kind of providers outside of the school who are psychologists who they would accept an outside evaluation from to inform school or educational planning. So they have certain providers in the community that they accept evaluations from. And they're really typically not neuropsychologists because neuropsychologists are not school psychologists. And often the school wants someone who is a school psychologist to be doing the outside evaluation that's going to inform the school. So there are different ways in which you might go about requesting a neuropsychological evaluation as a family member. You can do that through asking your physician to make a referral or a therapist to make a referral. You can yourself call and look around and find a provider through your family network that you have in your local setting to ask for an evaluation like this. And then you would want to know about how it was going to be covered financially. So you'd think about that. And we're going to talk about that when we talk about barriers in general. So the reasons for the evaluation might include that there's a presence of a neurological disorder like spina bifida, seizures, a tumor in the brain. a brain injury has happened, like a trauma to the head, like someone was in a car accident, for instance, and had a head injury. Other medical problems like prematurity or chronic health problems, genetic disorders, cancer treatment are good reasons to think about a neuropsychological evaluation because they have known impacts on social, emotional, behavioral, and thinking skills. Exposures to alcohol, smoking, or certain drugs prior to birth also have impacts on someone's skills that a neuropsychologist might assess and have expertise in, and then developmental or school problems. So having a learning challenge or having a neurodevelopmental diagnosis like autism spectrum disorder, we know that there are certain kinds of patterns of differences in thinking and behavior that occur in those settings, and a neuropsychologist might help to specify uniquely for that child what those are to help direct their care a little bit better in different places where they live, work, and play. Another reason why a neuropsychological evaluation might be done is if another psychologist or the school or a different treating professional who's working with that child has done an evaluation, but there's still some challenge existing. So it seems like something's missing in terms of the overall picture of that child or a piece of the pie that's not well understood. So a second opinion might be requested by the family or the treating provider. And then the neuropsychological evaluation might help to peel over any rocks that have not been turned over in terms of explanation and understanding of that child's behavior. Okay, so how are results communicated to a school? There are a few ways. So there's some core ways we think about communicating with schools about neuropsychological evaluations that happen. And again, these would be happening outside of the school education setting. There's an evaluation report that's written. Those can range in length from 2 pages to, I've seen very, very long neuropsychological evaluation reports, meaning 20 pages. At the Children's Hospital, we write or attempt to write at a reading level of around 8th grade, but there is jargon that cannot be taken out, and so those evaluation reports are, written to be for multiple audiences and multiple readers, schools included. So we think about all of those different potential readers of our reports, but there is a report that is the product describing the results and the diagnoses and impressions of that clinical psychologist, neuropsychologist at the end of the evaluation. There's also direct communication that can happen between educators and neuropsychologists, and often that means a release of records or a release to talk with the school is given by the family in writing. And so that the neuropsychologist might then be able to communicate with educators directly, kind of peer-to-peer or colleague to colleague about what they're seeing and have a more collaborative relationship. Families and parents might end up communicating directly with educators about what they heard from the neuropsychologist and their feedback about what the results were. And I think that often does happen as parents being advocates for their child in different meetings that they have with the school. And the neuropsychologist may participate, excuse me, in school or special education meetings. So I have been in a few IEP meetings that were requested by a family for me to participate in. I would say that most often happens for me in a hospital or health setting for children who are stepping down from acute care in like an inpatient hospital setting and have very different function all of a sudden from maybe 3 or 4 months before when they were in school, because for instance, they had a head injury. And so now their needs in the school setting are very, very different. And it's important for us as health team to communicate and work very effectively and immediately, quickly with the child's school system for them to get back to their normal life. So those are the ways in which we may communicate results. Those results can affect schools in a few ways. So they might augment interventions that are happening. So if a child is known, for instance, to have or found through a neuropsychological evaluation to have a lot of attention trouble, that's new. That might change the way a speech pathologist thinks about working with that child. And we might suggest specific kinds of interventions within a speech therapy setting that really might help the child to access that speech therapy work much better despite their attention challenges. We might suggest or adding accommodations or interventions. So if a child has clear behavior challenges, for instance, a diagnosis of a disruptive behavior disorder following our evaluation, but there isn't an FBA that's been completed through school or a behavior plan, like a positive behavior support plan in place, we might suggest that that be done to help address those behaviors in the school setting. Individualized treatment plans. So we attempt in our recommendations to make very specific, individualized to the child's thinking skill profile recommendations. So for a child with visual information processing challenges, that you might always give a verbal kind of instruction along with any visual that you provide to them, because the visual information is not processed well by that child. Things like that are very individualized to the child's needs. We might suggest ways to augment education plans over time. So thinking about that child kind of as a developing, changing person, for instance, someone post-acute hospital care, I might say for the first 6 months into school that I really recommend they go for half days, but that in 6 months that's reevaluated and that they may be joining school more often over time because they're recovering from their traumatic brain injury, for instance. And so we kind of think about them as a growing, changing person and try to make recommendations like that. So we're going to talk a little bit about barriers now to having a neuropsychological evaluation. So I know there may be questions in this space. So one is cost. So a neuropsychological evaluation can be covered by insurance. If the insurance company receives a pre-authorization from a provider and that insurance company deems the evaluation necessary, like medically necessary, for instance, for that child to help direct their care. Otherwise, it can be a paid out of pocket kind of cost if insurance does not cover that kind of evaluation for a child. But I would say you should always go around the insurance route to see if that's possible through your insurance provider. Also, oftentimes children in Pennsylvania have their may have a private insurer through their family's insurance profile, but they also might have a medical access card, for instance, so that they have a state kind of insurance so that they're kind of double insured. And so it's in some ways that helps getting these things covered because one of those insurers may cover this kind of evaluation. But it is a cost. So you do want to check that out before you would kind of go down the road, right, of a neuropsychological evaluation. There are long wait lists. Another barrier is just waiting. So for instance, embarrassingly, I can admit that our wait list at Children's Hospital to see children is over 1,000 people right now. And we have 8 neuropsychologists seeing kids. So we have a lot of need and a lot of providers, but the need keeps growing. And this has been since the pandemic. We have seen increasing referrals and we're trying to maintain our staff to make sure we can meet that need. But I think that this is a common problem across a lot of settings, not just in a hospital, but community providers have wait lists as well. The ability to get a referral. So in order to get insurance to pay for it, you would probably have to have a referral from a doctor, for instance, or a provider like a therapist. So getting that is a tricky thing sometimes, kind of where to get that referral. So you might start with your primary care physicians, pediatricians, things like that, or maybe even a specialist kind of physician that you see or some other provider who's the insurance company would see as someone who could make the judgment about the medical necessity, for instance, of the evaluation. You also have to find an appropriate provider. So sometimes that can be tricky. Kind of where do you locate a neuropsychologist in your community? And so we have lists, for instance, at the hospital to refer families to of all the different folks we know in the community. And also I would recommend calling your local hospital, or you can call your local agency that kind of, if you search for neuropsychology and ask for a list. Also, your insurance company generally should hold a list of neuropsychologists in the area. Relationships between families and schools is something to think about. So when you go to look for a neuropsychological evaluation, if you're doing that to get a second opinion because you've had an evaluation in the school setting and that evaluation you feel was lacking in some way so that you want some, or you just want more information, then you have to kind of consider how it is requesting that and going about that with the school so that you're kind of you want to give that information or second opinion back to the school. How is it going to affect your relationships with your school system and the place where your child goes every day? So I think that that can be a barrier to moving forward. In terms of use of these results in schools or how we collaborate from cross settings, neuropsychologists outside of a school with a school, I think one of the barriers can be jargon. So our reports, as well as school reports, have their own language. And the words that are used are not words that everybody uses in kind of the general public. And so communicating, and as we talked about dyslexia and specific learning disability earlier, we might be talking about very similar things, but have very different words that we use. And so it really takes both sides of the aisle or all sides of the aisle to start to understand each other's terms, to really come to an understanding that's best for the child. So cross communication is really important. There's often lack of understanding of each system's rules and guidelines. So like I said, we each use different ways of thinking about kind of categorizing challenges. And so that might be hard in terms of collaboration across different providers with different backgrounds. There's time that it takes to communicate, and sometimes communication happens in the lags. You leave a message for someone, they don't get back to you for a few weeks. You leave another message, you're playing phone tag. There's barriers to kind of getting consent to even communicate across schools and different kinds of settings, so that all of those pieces of communication and the lag in time can be barriers to using results quickly across different places. Schools are only also required to consider the results of an independent neuropsychological evaluation that you might get outside of school. So if you pass that along to the school, they have to look at it and consider it, but they don't actually have to take any of the recommendations and apply them in the school setting. That's up to them based on their knowledge of kind of what is going on for the child in the education setting. So we can encourage or make recommendations related to school, but in the end, it is the school's decision about how they go about incorporating those things. Okay, so I'm going to escape out of my